practicing medicine, I worked in a geriatrics office where most of my patients were 65 years of age or older. And my typical patient was on about 10 or 15 different prescription medications. And I had about 8 to 10 minutes of treatment time with that patient. Well, as most of you know, I like to talk a lot, so that certainly wasn't enough time for me. So as a result, most of the patient visit became more about medication management. You've got this symptom, let's give you this medication. You've got that symptom, let's give you that medication. Well, the problem is that most of those symptoms were actually side effects of other medications. So if somebody came in for headaches, I'd give them something for the headaches, and now they'd have dizziness. So then I gave them medication for the dizziness, and now they'd have nausea, and so on and so forth. Well, after some time of practicing like this, I truly became depressed. This is not how I imagined myself when I was out there practicing medicine as a doctor. For as long as I can remember, ever since childhood, I wanted to be a doctor. And here I was, finally doing what I wanted to do, and I hated doing what I did. So at that point, I was at an important crossroads of my life. I had two choices. Either I keep doing what I'm doing and stay miserable for the rest of my life, or I change my career. The only problem is it took a lot of time, effort, and money to become a doctor, and it wasn't easy to change my career. And even if I did, I really didn't know what else I wanted to do. Well, it was around that same time, unfortunately, or maybe fortunately, that my son started to have chronic health issues. He was only 4 years old. I was taking him for months and months through the traditional medical route, and instead of getting better, he just kept getting worse and worse. So this was not a very good time in my life. Well, finally, as most of you do, I went on the internet and I started to research. I said, there's got to be something else out there that can help him. And that's when I came across a functional medicine doctor. I took my son to see her, and in that 1 month of care that she provided, he had seen more advancement than he had in almost 1 year of traditional medical care. He started to gradually get better, and I'm happy and proud to say that today he's a healthy young man ready to start college next year. I can't even imagine where he would have been today if I hadn't have taken that important decision. So this situation, however, put a light bulb up in my head as well. I said, I found my answer. I don't have to change my career. I can still be a doctor. I just have to change the way I practice medicine. And that's when I stepped my foot into the world of functional medicine, and I've never looked back. And I'm happy and proud to say that I truly am one of those people that enjoys my job. I truly enjoy coming into work every day and being a part of each and every one of your health journey. There's nothing more satisfying than seeing people actually get better, especially after they've been dealing with chronic health issues for many years, and especially if they never thought that they could get better. So let's get into a little bit of background of the system and why some of this came to be. As you can see on this chart over here, the United States spends twice as much on healthcare compared to any other high-income nation or well-developed country in the world. Yet, we rank the lowest in terms of healthcare outcomes, such as quality and length of life. So why is it that we're spending so much money on healthcare, but have the lowest rankings in health? Well, this is not a political talk, and I'm not going to get into all of that. But one of the reasons is because as a society, we are very much focused on sick care rather than preventive care. Most insurance companies don't cover wellness. As a result, we wait for our symptoms to progress and our conditions to progress until we get to the point where we are diagnosed with a chronic disease. And chronic diseases cost a lot of money. They're expensive and many times irreversible. And I'm sad to say that unfortunately, the United States also ranks the highest in chronic health conditions compared to most other high-income nations in the world, as well as has the lowest lifespans. So as you can see on this slide over here, just some statistics. Again, chronic health is expensive. So avoiding diabetes can save an average of almost $8,000 in healthcare per individual per year. Avoiding heart disease can save an average of almost $6,000 in healthcare costs per individual per year. Well, we all know how to use and appropriately use our insurance for our home and our car. We know it to be a financial arrangement in the event of financial ruin, such as a house fire. However, we continue to spend money on maintenance and upkeep as needed for our homes and our cars. Somewhere along the line, however, the view of healthcare insurance became distorted, where we tend to use healthcare insurance to make all of our healthcare decisions for us. If insurance doesn't cover it, we don't do it. So why is it that we treat our body less than our homes and our cars? So let's look at some definitions here. What is health? It's a state of complete physical, mental, and social well-being, and not merely the absence of disease. What is wellness? It's an active process through which people become aware of and make choices towards a more successful existence. However, you all already know that. You've already taken the first steps towards your health and wellness by stepping into functional medicine. You already know that you dictate the future of your health, not your insurance company. And at Rose Wellness Center, we also take a very patient-centric approach, where you and I sit together and we make our healthcare decisions together. We don't allow insurance companies to make that decision for us. Now, I'm not saying we shouldn't use our insurance company. Of course we should use them. We're paying them a lot of money. We better get something out of them, right? And as you'll see a little bit later, a lot of these membership plans are actually 70 to 80% insurance reimbursable. But what I am saying is that we shouldn't allow the insurance companies or the judgment of the insurance companies to compromise our care. So we know that functional medicine looks for underlying causes of chronic health conditions, which are mostly rooted in lifestyle choices, nutrition, and environmental exposures. We also know that functional medicine takes into account the whole body, mind, body, and spirit. But it's important to take things a step further, and that's education. As you all know, I spend a large part of my visit educating you. Because once you understand what is happening and why it's happening, the health transformation begins. You feel empowered and you have renewed hope. Functional medicine is also a process, however, that takes time and commitment. However, the reward is a lasting health, mind, body, and spirit. So we work together. I listen for clues in your story. I put those together with advanced labs and diagnostics. I analyze or gather all the data, and then I report it back to you, as well as we discuss and recommend lifestyle changes. So we work together to solve the puzzle of your health to take you where you want to go. In the past, we used to think that we were genetically prone to certain conditions, and well, it's in our genes, we can't really do anything about it. So my father has diabetes, I'm definitely going to get it, and when I get it, I'll start medication, and that's the end of that, right? Well, we now know that that's not the case. Our genes only dictate 20% of our health and well-being. The other 80% is determined by lifestyle choices, the food that we eat, how we sleep, how we manage stress, how we exercise, and how we interact with the world around us. So that's pretty powerful. There are many research studies done on lifestyle medicine, but I put one of those examples on this slide over here. As you can see, a large number of people adhere to four simple behaviors: exercise, don't smoke, eat healthy, and maintain a healthy weight. In those people that actually adhered, there was a reduction in 93% of diabetes, 81% of heart attacks, 50% of strokes, and 36% of all cancers were prevented. So if you acknowledge lifestyle medicine, you also acknowledge that health is a skill. It's something that we have to keep practicing at. If we want our health to come back or regain that, it is a practice. And even when we get to the point where we are feeling good, we have to continue to maintain that. Because as they say, if you ignore your health long enough, it's going to go away. So this changes the reorientation between the doctor-patient relationship from I'm the doctor, you're the patient, do as I say, and I'll fix you, to I'm an expert in medicine, you're an expert in you, let's work together to take you where you want to go. As Thomas Edison said, the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. So when I first started practicing functional medicine, I only had a quarter of the functional medicine knowledge that I have today. But I did know one thing was important, and that was lifestyle changes, nutrition, and diet. So there's a story of a patient that I had that came into me one day when I first started practicing. She was in her 40s. She walked in with a cane, severe tremors. Her husband drove her there because she couldn't drive. She was on 4 different antipsychotic medications. She was on disability, and she looked like she was about 70 or 80. She felt miserable. Well, as I typically do in that 90-minute, new patient evaluation, I did a thorough history, and I found out that she was eating a lot of fast foods and processed foods. In fact, her entire diet consisted of that for many years. Well, I spent a lot of my time really discussing diet, organic foods. In those days, people didn't even know what organic meant, right? And I sent her off with just a couple of basic vitamins. Well, she came back in 3 months later, no cane, barely visible tremors. She drove there herself. She was looking for a job. She was off of 2 of her antipsychotic medications, and she felt great. So I asked her, wow, you look great. What did you do? She said, I just followed your advice, Dr. Hirani, right? So I say this story because, not everyone's going to get that dramatic results, but I like to point out the story because it truly shows the impact of nutrition, diet, environmental factors, and lifestyle changes, which we can't underestimate. They play a huge role in our health and well-being. So in today's current practice model, most of you walk out of my visits looking like that, right? With a bunch of questions. Trust me, I realize it. So you walk out going, what did she say? What does she want me to do? How am I supposed to do that? Can I do that, right? So I give you your list of your do's and don'ts, and I send you out. And then I trust that you will somehow find a way to put all that together and make your lifestyle changes. And so now I'm at a new crossroads because this has really been bothering me for the last few years. I've been thinking to myself, how can I make this better for my patients so that you're able to get better quicker and stay there? And so, this whole cobweb of trying to figure out how to make the right lifestyle changes, that's what I want to really clear up. So my goal with this new membership model is to provide additional support and tools that you need, along with the care team, to help you put all this together to provide a truly integrative practice and healthcare. So the most integral part of this change is going to be your access to a health coach. I don't know how many of you know what a health coach is, but just like the name implies, it's somebody that helps coach you through the different lifestyle changes. So as we go through your history, I would be creating personalized lifestyle changes for you in, all the 4 factors: nutrition, stress management, sleep, exercise, and whatever else is necessary. And then the health coach, using her skills, expertise, and resources, helps you to implement them and put those together. One of the things that I have seen in my years of practice is a lot of my patients go 2 steps forward, 1 step backwards, 2 steps forward, 1 step backwards. And that's either because it's taken them time to understand how to implement these lifestyle changes. There's this whole new world, right, out there for them, or they know what to do, but life gets in the way and it's hard to implement and actually keep on track with all these important things. So that quote on the top, I think, perfectly describes what a health coach does. Give a man a fish and you feed him for a day. Teach him how to fish, you feed him for a lifetime. So having a health coach is the difference between falling off the wagon again and finally getting the results that you want. It's the difference between knowing something and doing it. It's the difference between I want to do it and I did it. It helps you feed the opportunities, starve the problems. And a health coach is really a wealth of resources to help you see these persistent problems through fresh eyes. So if those of you have been struggling, why can't I get this better? Why can't I, just get this right? Or why do I get better and go backwards again? A health coach can sit with you at your level, walk with you, at whatever pace you want to do, and help find out what might be the personalized issues or concerns and how we can get through this to, again, not only get better quicker, but to stay there and maintain health. There's been lots of research done on health coaching. Those people that actually work with the health coach get 2 times as much symptom resolvement in half the time compared to those people that don't work with health coaches. So again, imagine getting better in half the time, right? That's an awesome goal. So as you can see on this slide over here, working with the health coach improves self-motivation, improved health behaviors, improved health outcomes, and reduced healthcare costs, okay? And again, this is not just while you are healing, but even research has shown that once you get well and feel better, you stay well for much longer if you've worked with a health coach. So my goal here is really to provide that marriage between functional medicine and lifestyle medicine. Imagine if I could dedicate my entire 45 to 60 minutes of the visit with you purely focusing on the functional medicine, and then you work with the health coach additionally for that 45 minutes and really focus on the lifestyle medicine. And the marriage of these two can take you so much further, so much quicker. Along with this, we will also be implementing something called the Lifestyle Guidance Portal, which is a cloud-based portal and app which helps enroll you into lifestyle and care programs, unique ones or personalized ones that we've developed especially for you, where you receive guidance and instructions on a regular basis so that you can stay in touch with the health coach even between visits. Additionally, we are also implementing new lifestyle technology, where we will be looking at simple things such as your blood work, for example. Your regular blood tests that you do at the lab will be analyzed using a science called functional blood chemistry analysis to help pinpoint further underlying health and wellness imbalances to gather even more useful information to really put your health picture together more comprehensively, as you can see on this chart here. Really pretty cool. So this leads me to the hardest and really the most difficult part about this decision. A practice of the size that I currently have right now does not allow me to provide the kind of care which means so much to you and is in line with my own integrity and the quality of care that I wish to provide. So unfortunately, I'm going to have to reduce my current patient population so that I can give you a lot more. Even today, I spend a lot of time, aside from the visit time that I spend with you, out of the visit, really trying to put your care together. Imagine if I had more time to take those extra steps to help you improve your journey to health by reaching out for further resources or more research. I have really worked closely with all of you in your individual health journeys, and I've seen some of the struggles that you have been through. And I just want to take this opportunity to say that I truly appreciate, admire, and encourage you to continue your journey towards health. Don't ever give up. I hope that most of you understand why I'm doing this membership and hope to stay. But if you choose not to, it's not for everybody, that's okay too. As I've always encouraged you to make your own healthcare decisions, this is no. So thank you so much. I'm going to pass the floor on now to Claire, who's going to get into a little bit more detail about what the programs entail and what the membership includes. Again, thank you so much, and then we'll take questions at the end.
Thank you, Dr. Hirani. So all of you have already invested in your health. You don't know me, so it's not my job to sell you today. It's just my job to help you understand the benefits of membership. So our most popular membership plan is the comprehensive. It's going to include that annual functional medicine assessment, as well as that Dutch hormone test that you all are currently utilizing. You get 3 follow-ups with the physician and 4 of those really important health coaching sessions. You get access to the portal, your health management plan, and of course, those in-body scans that you love so much and the infrared sauna. It's a monthly fee of $225, or you can save a little bit of money and pay for that annually. It's up to you how you want to continue the plan, but it is one of our most popular. The next is our premium membership. This is for somebody who needs a little bit more time with Dr. Hirani. Also, if you wanted to, it includes that ION nutritional analysis test. So you get one more lab with that. You get 6 health coach sessions. So again, it's going to be for someone who needs a little bit more access and time to really drill down on those chronic concerns that you're having. Both of these do come with the 10% off supplements. And I didn't mention it, but you do get access to the other people within the practice as well. And you have discounts for them. Now, maintenance is a little bit different. This is going to be for people who have been at the practice for a specific amount of time and are in a maintenance mode. It does require a pre-authorization from Dr. Hirani, but it is available. If you think that is where you fit in, just let us know, and Dr. Hirani will be able to work with you on whether or not you do qualify for that membership package. Here, you're just going to get some of the other features. But the next thing is our community partnerships. So many of you know where we're centrally located. We have a lot of really nice partnerships around us. So the fitness center, and as well as some of the other communities in the other partners in the area will be working with us. And we have worked on a negotiated rate for you all as members to be able to get some of the really nice deep discounts at those vendors. If you want to list, just let us know. So next steps, we're really just looking for you to let us know sort of where you are today. The goal for this meeting is just to kind of help us decide, where are you feeling? Are you feeling like you need a little bit more information? Are you ready to reserve your space? Kind of where you are in the process. So I invite you all, I'm going to put in a new, up on the screen here. You'll see this is our membership page. And if you haven't had a chance to access this, I highly encourage you to do so, to go on here and see if you can drill down again, any more questions about each of the individual plans and what they contain and what they cover for you. And then if you log in here, you'll be able to join right through your portal. So it'll take you just to log into your patient portal, and then you'll have a membership option on the side. Now, for everyone here in this meeting, I ask that you, before you jump off, I'm going to send you this link here. And if you could just put your name and a quick intention, that'll help us. We still have quite a few patients to get through, and we don't have that many spaces left. So we're really trying to help everyone that we can identify, where you are in this process, like I said. So for now, I'm going to open it up to some questions. I know there are some questions that have already come in from people that were not able to join us today. So I'm going to go through those now. The first one is about the actual sessions themselves. So here, if you notice, when you have these visits with the physician or the health coach, they are either in the office or virtual. So if you needed to, you could meet with Dr. Hirani just like you are now, seeing her live and in person. Hello, how are you? So you can meet with her if it's more convenient for you to do that at home or from your office. And then also we had a question come in about a primary care provider. And so one of the things that we really want you to know is that it's still business as usual at Rose Wellness for a lot of those things that you're currently utilizing, as well as you still need to have a primary care provider. We are not a replacement to that, nor is this a replacement to your insurance. So those are the two that came across earlier. I'm going to go ahead and open this up and see. So that's a question. So we actually have somebody who said they're interested, but when do we need to know? So everything is going to change over in August. We'd like for you to know, we'd like to know by August 15th, but if you can, or if you are going out of town or anything between now and then, I highly recommend that you just reserve your space. The only thing you're going to be charged with is the reservation fee, and then you'll be able to go from there, and you don't get charged for your monthly fee until August.
And also, until July 15th, we are only prioritizing this for my current patients. We don't want, we want to give all of my current patients that first priority. After July 15th, if there is still space available, we will open it out to other new patients.
That's a great point. Right now, we are filling up with just current patients. So it is important that you all know as soon as she sort of I guess unleashes the hounds or turns off the faucet, I guess those people are going to come in from outside that have been waiting on a waiting list to get in to see her. So I'm going to put this in the chat. All right, we have another question. How do I know what program I will need? That's a great question. So how do you know what program you're going to need? Well, Dr. Harady, do you want to answer that?
Yeah, please feel free to get in touch with our office. You can send a portal message or you can just call. Amy and I have really kind of sat through and gone through a lot of you already to determine what might be the best program. So give us a call. And, most people, what I've been finding is whatever program I recommend, most people pretty much agree that that's where they need to be. But if there is any disagreement, we can certainly discuss it. If you are in maintenance, which is just the 2 visits a year, you would need written, approval from me. But again, most people know who's maintenance. Maintenance is if you're feeling pretty well in general and you're just basically maintaining your health. The way to think about it also is maintenance is approximately, we see each other 2 times a year, and you see the health coach 2 times a year, which is every 6 months. Comprehensive, we see each other approximately every 3 months. And in Premier, we see each other approximately every 2 months. And then also, by the way, you're not restricted to that. That is just the foundational, kind of what's included in the plan. If suppose you are maintenance and you're getting, you're seeing me every 6 months, but you need that additional visit, absolutely you can get an, additional visit or 2 for whatever the office rates are.
Perfect. We have somebody asking about insurance companies. Which insurance companies cover over the 70%? The easiest way to answer that is just to check with your insurance company. I think if you want to talk to Amy, she's available as well to sort of sit down and show you which of those are usually covered services versus non-covered services. And we can.
By the way, I'm considered an out-of-network physician. So typically whatever your out-of-network rates are, that's what you would be getting through your insurance. But absolutely, as Claire said, you'd have to check with your insurance company.
We have lots of questions coming in. These are great. So the other one is, am I still going to be able to purchase supplements if I don't decide with membership? That's a great question.
Yes, you will be. The Vital Living website will still be open to patients. Probably not at the office, however, because at the office we only give supplements to patients because of the medical legal liability aspect of it. But Vital Living will still be open. The only difference is members will get 10% of all of their supplements. That will probably give you a different code so you can get the 10%, whereas non-members would still continue to get it as they do today.
And then I have actually 2 questions that have come in. They're very similar. They're around the location of where they are versus where you are. So you do have a lot of out of town, out of state, out of country patients. And so just to sort of answer that for you, if you want me to, what I mentioned earlier about the virtual sessions, we have patients all over the world. So whether you're a member of the practice and you're local or you're not local, you can still utilize those same benefits.
Yeah, with the virtual visits, which is a video conference, similar to what we're doing right now, except of course it would only be me and you as the patient. The nice thing with it is because it's considered a face-to-face visit, it is insurance reimbursable. So this actually makes it better for patients that live out of town. Instead of doing the phone visits, which were not covered by insurance, we get to do going forward the virtual visits, which is insurance reimbursable. And of this whole package, it's mostly the physician visits and the testing, which are the insurance reimbursable parts of the program.
And Amy actually made a really good point. I don't know if you all can see in the chat window here. She mentioned that for those of you that are out of town, you can block your visits together. So you don't have to spread them out. You can actually put some of those health coach visits right back to back with your Dr. Harady visit. So that way you're really maximizing the time if you come into town.
Yes, and the virtual visits are with me as well as the health coach. So again, it's something you can do video conferencing with as well.
Perfect. Well, it looks like we've gotten all of the questions answered. We will be sending out a recording of this to all of you. So if you're watching this on recording, I still ask that you go in and let us know your intention using that same link provided. And if you need anything, you can always reach us here at the office. We do have a membership line due to the overwhelming response. We've added a new line that's goes to myself and our team here. So if you have any questions, call the office and just press 1 and you will get one of us.
And somebody did ask a question, is there any flexibility for, some of the other options in the office? Please call the office and we can talk. We can let you know what that flexibility or other options are as well.
Perfect. Well, thank you, Dr. Hirani. I really appreciate it. Thank you all for joining us here today, and we will see you all very soon.
Thank you so much.
Bye-bye.